My name is Dr. N. Raghavan. I am a urologist, uro-oncologist, and a robotic surgeon, especially in robotic uro-oncology. I want to give you a brief introduction to uro-oncology and robotic surgery, especially the value of robotic surgery in uro-oncology patients. This is called a surgical robot, and you are seeing the various components of it. This one is the patient cart. It has 4 arms. This is the middle one, is the one which has the camera, and the 3 arms are useful to holding the instruments, and this is controlled by the surgeon who sits in the console here to do the operation. The robot does not do an operation on its own. It primarily is controlled by the surgeon. The advantage of the robot being the surgeon's movements are far more precise, and therefore the operation is far more smoother and the patients recover much faster as well. The blood loss in robotic surgery is very minimal, and hence patients recover from the operation and are back to their normal life very quickly. Especially, it helps to maintain the quality of life for the patients, enabling them to return back to their normalcy very soon. Whilst the surgeon is sitting there and operating, the patient side surgeon stands by the side of the table, and he is able to see the operation in the monitor, which is called the vision cart. The patient side surgeon is able to see all the operation that the surgeon in the console is seeing. The only difference being the surgeon in the console sees it in a 3D vision, whilst the surgeon by the side of the patient sees it as a 2D. This is one of the robotic instruments. This is a scissors. These are the components of the scissors. This one goes into the machine, and this is the one which is helpful in operating the patient. As you could see, this is a very fine instrument, and it is capable of moving in many directions, more than what a wrist will move. Move the instrument to show how much it moves. It moves in all the directions. So such a fine movement inside the patient body will help us to do very precise operation. Similarly, there are other instruments which have the same, what we call endo wrist, that moves in different directions, so that the movement of the instrument happens only at the operative field and nowhere else. And this is a particularly important reason why the patient have very less pain and the operations are very precise. Robotic surgery is especially useful in patients with prostate cancer, bladder cancer, renal cancer or kidney cancer, as well as it is useful in patients with penile and testicular cancer as well. Overall, the robotic surgery is the way forward for uro-oncology patients, that is patients with cancers in urological organs. Especially in prostate cancer, the radical prostatectomy using a robotic technique is now accepted throughout the world as a standard modality. The patient stays in the hospital for 1 or 2 days and are home by day 2 or day 3 and have recovered very quickly and are back to their normal life by 4 to 6 weeks. And in patients who have kidney cancers, we can remove part of the kidney, leaving the rest behind, called partial nephrectomy. And doing this with a robotic technique enables us to have very minimal blood loss and helps the patient to recover quickly, as well as preserve the renal function. And in patients with penile cancer, robotic lymphadenectomy can be done, which is very useful and reduces the morbidity or the complication associated with traditional open operation. Special interest is uro-oncology, and I look after patients with cancers in the urological organs, namely kidney, bladder, prostate, penile and testicular cancers. In addition, I also look after patients who have stone problems like kidney stones or stones in the tubes or stones in the bladder as well. I also look after patients who have range of urinary problems, both in children as well as in adults. My other interests include andrology and infertility as well. Welcome to our clinic, and I offer a comprehensive service for patients with urological problems, looking after them through the process as well as enabling them to recover from the problems very soon.